Welcome to the December 2nd COVID-19 update. This is something that we try to do every Wednesday, and I try to bring guests on where they might answer questions that you would like to know about. Today, I have Clay Horton with us again. This Clay has been with us on several occasions to talk about COVID and what's going on and the possibility of vaccines. I have County Attorney Claud with us today to probably answer a couple questions that have come about regarding the mandates, the protocols that are being sent down to us by the governor. So I want to start out by telling you guys that we have had another bad day. Clay, I think we had 96 cases in Davis County today. As I look over the reports, we now have had 3,602 confirmed cases in Davis County. The good news is we've had 2,719 of those cases recover. Unfortunately, we've had 53 Davis County citizens pass away as a result of COVID. And what really sticks in my mind, and Clay, I'm going to get you to talk about this here pretty quickly, is that we now have 803 active cases in Davis County. And that's a huge increase from what it was just a couple months ago. Today, I'm encouraged. I think yesterday we had 18 or 19 people who are in the hospital. Today, we're reporting 13. So Clay, I'm going to turn it over and let's start this out by having you talk a little bit about what's going on in our county and since you're the director of the Green River District Health Department, what's going on in our Green River District Health or the Health District, and what's your take on a huge increase over the last 6 weeks of infection rates? Clay?
Yeah, thank you, Judge. Thanks for having me join you again today. Yeah, I think you did a good job of summing that up. The number of cases have just really been steadily increasing, and especially the last 3 weeks, we've seen just a major, and not only our region in Davis County and in our 7 counties here in Green River District, and the region of the nation for that matter. So, I think the United States is leading the world right now in terms of current infections. We are doing a little better here in Kentucky than some of our other states in the region, but we're not doing well enough. It's just very difficult to control. We've talked about for the last 8 months that the major concern was getting exponential growth. That, as you see the doubling of cases and doubling upon the doubling, those numbers get big very quickly. And that's really where we're seeing. It's overwhelming the system in a lot of ways. Our hospitals and our healthcare providers are doing an excellent job. And they're as far as that's concerned, our community is doing much better than others. But it's very concerning, and it's something that we hope that we can get everyone's cooperation in control. And the good news is that if we do get people to make wise decisions, think about how to all the guidance that we talk about or we've been talking about for the last 8 months to their own lives. It's not going to be easy, but it can be done.
Clay, just for the audience out there, I think we're having internet problems throughout the city of Owensboro because you continue to freeze up a little bit and you're in and out, but I think they can probably read between the lines and get the gist of what you're saying. How soon do you think we will see an influx of cases, if any, as a result of gatherings at Thanksgiving?
Typically, we'd see that probably 10 to 14 days after the event. So, probably the end of this week. Thanksgiving holiday, I think, has disrupted our normal reporting patterns a little bit as well. So we're still seeing some of that sorted out with our backlogs. We may see the evidence that Thanksgiving and down, scaled down what their plans were with their. We don't know the answer to that question yet.
Okay, well, you really cut in and out, but I think the gist of your answer was simply this Saturday, Sunday, and 5-6 days after that. If we're going to have a large influx, we're going to see it then.
That is correct. And so
Okay.
I think when you ask Claude a question, I will try to disconnect and reconnect and see if that helps our
Okay,
connection.
I'm going to go over to Claude for just a second. You go ahead and try to get off and then back on. Claude, you're on mute, so you better take yourself off mute. Either that or I hope you've learned how to sign and all of us can read that. Welcome. Nice to see you here. Claude, there's been a lot made about the governor's mandate. There was some consternation back at the beginning of this journey when the mayor and I issued an executive order, and people talk about the governor doesn't have that power, local government doesn't have that power. Can you speak to 30, I think it's 39A.
39A, I believe, Judge.
A through F, I think. Would you speak to that a little bit?
Just basically gives the executive the authority to enter certain kinds of orders prohibiting or requiring certain either acts or behaviors. Of course, all of those acts or behaviors that they do or limitations must also comply with constitutional and statutory authority as well. And in these instances, when you have a public health emergency, at least the Sixth Circuit on the most recent decisions have been, I don't know about lenient, but it's been understanding of where the governor is coming from, given the nature of the beast, if you will, that we're dealing with, and has upheld the requirements because they are fairly narrowly drawn.
Claude, I know back with this last round of mandates, there were some requests by citizens that, as an example, the mayor and the judge promulgate an executive order that would override or overrule the governor's. Would you speak to that?
Those, because the local governments are an entity that are, in some ways, they are governed by the rules of the governor and by that executive branch, and cannot enter orders that are more restrictive or that countermand an order, an executive order, or a statutory requirement.
Okay.
So we can.
Now, if so, I want to be sure what I heard. If the governor said you must do X, I couldn't say we're going to do less than X, but couldn't local government add to and make that mandate more restrictive? So we're going to do X plus Y.
It's possible that the local government could do that because it's going above and beyond where the state has. Again, the local government has to comply with the same constitutional requirements. Right. So as long as it did not interfere with any other constitutional issues, yes, it could.
Okay. Well, I know that there have been a lot of there's been a lot of talk about that, and of course the mayor and I, on consultation with the county attorney and the city attorney, understand that we can't countermand the orders by the governor. Now, there are, and think about it in from the standpoint of a health pandemic, the governor actually should be the one that is guiding the ship, because this pandemic knows no county boundary, no city boundary. Certainly local authorities can issue executive orders, but those orders are contained within the legal boundary of the city or the legal boundary of the county. So, we might have a tornado here, but it doesn't affect McLean County or Ohio County. And so that order would only apply to Davis County.
Right, correct.
So Claude, or I'm sorry, Clay, are you back?
I hope so, Judge. I can hear you all loud and clear. Your video's pausing from time to time, but I can't hear everything you're saying.
Okay, and that's kind of, your video is doing the same thing, but that was much better audio. I don't recall, did we talk about, if not, and I know we didn't, why are the numbers being released by the state? Why do they differ every day?
Well, the state is.
Your audio's gone, Clay.
Let me try to disconnect and reconnect again.
All right, I'll go back to Claude for just a little bit. Claude, for the most part, we have looked, and I'm glad Clay's gone so he can't throw things at us. We have looked at the health department to be the ones that enforce the governor's orders. Certainly the sheriff's department, police department, and the city of Owensboro don't have the manpower, number one, to go around and be the mask police or the crowd control police. In talking to both departments, they said, look, if somebody comes into a private place of business, they're asked to put on a mask, they refuse to, then, and the owner would ask them to leave the business. If they refuse to do that, they could call the sheriff or the police department and they would remove them or charge them with trespassing. I think you would agree with the statement I'm about to make. We don't want that to happen. We don't want to see people fined. What we want to try to do is counsel people, you know, what you can do to come into compliance. It doesn't do us any good to collect a fine. Doesn't do us any good to threaten to put somebody in jail. We're just trying to look out for the safety of everybody. And while some people would say that, you know, they are in charge of their own safety, we don't have a right to do that, I think I'm safe in saying that I'm mandated by state law and federal law from the position that I hold to watch out for the health and welfare and public safety of everybody in our county.
You are, Judge. That's one of the statutory obligations of the judge executive and local officials is health and safety of
Right.
health, safety and welfare of the persons within their jurisdiction.
Now, if somebody were to issue or an order that countermanded what the governor said, can you talk about malfeasance and misfeasance?
Well, those are both criminal offenses that an elected official could be charged and possibly convicted for knowingly violating terms of a valid order or statutory
a lawful order, right?
Yeah.
So that you will see elected officials again on council by the county attorney and by the city attorney that look, this is very serious because if you don't do what you have been ordered to do by the legal authority, then you're subject to fine and removal from office and possibly a jail term.
It could be, yes.
Clay, you back?
Hopefully the third or fourth time is the charm here. So
all right, well, real quick, so we don't go too far into this, and this is a good question. Can you pinpoint the sources of cases in Davis County? Is it group gatherings or a certain event?
they are all over the place. We are still doing contact tracing. It becomes much more difficult with the volume of cases that we have. But we are seeing general community spread. We're seeing lots of small clusters. We are seeing outbreaks in long-term care facilities, which become very difficult to stop and prevent when you have this level of community spread. We're seeing clusters associated with private gatherings. We're seeing small clusters with workplaces. So yes, we are doing those type of investigations, but it's not something that you can point to a single source in Davis County or our region or our state. I think we're in a position now where you have to assume that COVID is everywhere in our community, and always be vigilant and cautious about what you're doing and taking care of yourselves and taking care of those around you.
Okay. While you were gone, Claude and I blamed the enforcement of all this on the health department. We said that we're not involved in it, so we thought we would do that so you wouldn't use an expletive deleted. And of course, I'm kidding, because Clay is about one of the nicest people that I've ever met. What are we doing for places that are not requiring masks? And again, that's why I've got Claude here, because we'll talk about that a little bit. But Claude and I talked, we don't want to be the mask police. You don't want to be the mask police. You don't want to fine people. You don't want to shut people down. What you want is to ask them to come in compliance. So in conjunction with the question of what are we doing, how are we responding to complaints by people that they went into this place and there weren't any masks, or that there was a clerk that didn't have a mask on? What are we doing? How are we handling that?
So we have a team here, our environmental health team. They're the same folks that are normally doing inspections in restaurants or responding to complaints in the community about sanitation issues. And they're the ones that are leading the charge on this for us. And so we've been doing this for a number of months now. But we do collect all of those complaints. We do follow up on all of them. We sometimes that's with a phone call. If we've already called a place, then we'll pay a visit in person and see if we can verify, or if that, if non-compliance with mask wearing is something that's happening frequently in that establishment. If we see that, for a while we were providing education and trying to encourage, maybe provide some strategies on how to get people to comply. But we're at a point now where I think we've had all of those conversations, and we're following the directions that we've gotten from the state, how to proceed on violations like that, and we issue citations. The first one is an official warning, and the subsequent ones involve a fine. Now, we don't want to fine anyone. I don't, that's not. I'd be happy if we didn't have anyone we had to fine, but what we want to see is substantial compliance with wearing masks, because we know it's effective in terms of stopping the spread of COVID-19. So I know that we get calls about this a lot. Some think that we're fascist and we shouldn't be doing this type of enforcement at all. Others think that we're doing absolutely nothing. So what I would encourage is that for those that are upset about seeing others not wearing masks in the community, they should be polite, but they should try to enforce this by consensus. Report noncompliance to us, but also not patronize businesses that aren't enforcing mask mandates, and in a polite way, share your concerns with those that are in charge of that business, and let them know the reason behind your decision. The sooner that we can get everyone to get comfortable with this and get where that they can operate with wearing masks in this way, then the sooner this will be over.
Clay, a lot of complaints I get are from quick picks and places like that. You run in and run out, and you find a lot of those places that have plexiglass up. Bottom is open, top is open, and they are not masked. Speak to that. My opinion is about the only thing that does is keep them from spraying directly on you. It doesn't protect you at all the way a mask would.
It's certainly not nearly as good. Perhaps it's an additional layer of protection, and I can understand why businesses want to protect their employees in that way. But it's not a one-for-one substitute. I think the mask still needs to be worn by both customers and the employees. And you're also you also want to be considerate and protect other customers that are around you when you're in a business like that. So yes, plexiglass may be an added benefit, but it's not. It doesn't negate the masking requirement that we're currently under.
Speak to the conversations that I've had with some folks who are concerned. They go into a bank and they don't see them enforcing a mask mandate, and the bank is saying, we don't want masked people in our bank.
Well, I can understand the security concern there, and it's been a while since I've looked at it, but I think the executive order does allow for a brief uncovering of the mask for security purposes or for verifying identity. So I would encourage banks and businesses that have those concerns to still substantially comply with the mask mandate. If there is a security issue or they need to identify someone briefly pulling down the mask, just maybe something that we have to live with.
Yeah. Okay. Claude, let's talk about when you enforce, when you get a complaint, you almost have to be there and see the violation. I mean, it's one thing for me to call up Clay or to call up the county attorney and say, hey, so-and-so's, they've got people who are unmasked in the store. We show up, everybody has a mask on. How do you address that? There's not any way that I know of. It's kind of like you could report me for speeding, and most people would believe I'm speeding, by the way, but you could report me, but unless law enforcement catches me doing it, there's nothing you can do.
It's a little different in a facility, the convenient mart, a grocery, or a retail place. Then the officer goes there, they find that everyone is complying. They can at least talk to the clerk or whoever it is there and say, we've had this complaint.
Yes.
We're just checking on it and doing it. We're just letting you know.
Sure.
And that's about all they can do at that point.
Okay. Clay, another question from Facebook, and it's kind of funny. I was on a conference with the governor this morning, roughly 200 mayors and judge executives. The question is, will we locally have any input in the distribution of vaccines once available? And I think the answer is locally, we probably will not. They may consult with us somewhat. According to the governor, the first vaccines that are going to be available, I think we've got 38,000 doses coming in from Pfizer, and sometimes next week. Those doses, and by the way, 38,000 is just the first shot. So Pfizer and Moderna require 2 shots, the primary shot and then a follow-up booster. If you don't get the booster, don't think that you can get the first shot and be great, because the booster is what brings the effectiveness up to 95%. You will get some protection with the first shot, but not like you should. But the governor said primarily the first doses were going to go to long-term care and assisted living facilities, as well as our most vulnerable frontline workers. So you're going to get the people who are in nursing homes and assisted living homes. You're also going to get the employees there, and you're going to then look at people who might work in the COVID wards, the hospitals, those kinds of folks. It was eye-opening. We kind of knew this, but the governor said that 66% of the deaths occurred in those folks who were in assisted living or nursing home facilities. And of that, 60% of those total deaths were of people who were in nursing homes. We knew that by looking at our data. But have you heard anything? Have you been consulted? Is there any consultation going on with local officials about distributing the vaccine?
Yeah, so we've been engaged with both the state and various partners in the local area about how, what our plans are for distribution when we start receiving vaccine. These priority groups that you just described, your healthcare workers and people that are living in long-term care facilities. This is something that's taken a lot of deliberation and a lot of input from experts at a national level. So these are national priorities that are being described, and it's really kind of balancing the bioethics of the situation and determining for the benefit of society, where are we going to do the most good. So I think. Obviously, we're going to be involved in the distribution of that. We're going to take those recommendations at heart, and we're going to follow those. I think the real challenge is going to be the initial distribution of vaccine that we're going to see in the local area is only going to cover a fraction of the folks that fit into those categories in our vicinity. So there's more work to be done in terms of how to distribute that fairly and equitably to those that are even qualified within those, those 1A priority groups that the federal government is identifying or identified yesterday.
2 weeks later, the governor said we would receive 78,000 doses of the Moderna vaccine. So that's another 78,000, and that we would then try to get healthcare workers who are exposed, forward-facing emergency responders who are exposed. People who are exposed every day, and they're exposed not by choice. They're exposed by a job that we expect them to do. And then he's talking in terms of perhaps educators, and he made a good point. I never thought about it, but let's vaccinate our educators and those ancillary people necessary to run the schools, and then we reopen the schools. So, but in the end, those recommendations predominantly are going to come down to us from the federal government, the state government, I think is the question, or is the answer to that question. Had another one, and we've talked about it in the past. Before I get to this question, the question's about data. We read something somewhere this morning, I forget, I think it came out of Horton County, where the Horton County Health Department is no longer going to release updates regarding COVID.
Okay, had not heard that. So we intend to continue to release updates regarding COVID spread in our local community. I still get the question a lot in terms of incident rates and the levels of maps. We certainly have the ability here locally to make those calculations ourselves. We do make those calculations to check to make sure there's not substantial errors or any kind of material difference between what we're collecting here locally and what the state's reporting. But for consistency, I have been pointing people to covid19.ky.gov for those incident rates and those recommendations. But I think that if we were to stop providing daily updates, half my day would be answering phone calls from reporters. So we
the other half would be answering phone calls from mayors and judge executives.
Probably. So
the question actually was, why can't you aggregate the data and make it available to the public? And we make as much data available to the public as is reasonable. We don't have the time to spend all day doing that. And I have told people before, if you want to know more information, really, Kentucky COVID-19.ky.gov is an excellent site. You can go on there and look all day long.
I agree with that. There's lots of different demographics broken down there, we're doing the same amount of data analysis every 4 hours every morning that we used to do in a week. We'll try to continue to keep the public updated with our most recent numbers.
Here's a question that actually was asked of the governor. I thought the governor did a good job. Let's see if you're as good as the governor. Restaurants and bars around the state are looking to defy state orders. And again, I was pleased to see headlines of the local Messenger Inquirer that our local restaurants said they are not going to do that. I think they're wise, they're smart, and they're looking out for the health of their employees as well as their customers. But some are just asking for the data that show where infection and spread is occurring. So they're just asking, show us the data. Well, I suspect that some, if you show them the data, it wouldn't be good enough. But the governor made the statement that inside of public health communities, there's no question that restaurants, bars, and he added gyms are the biggest spreader of COVID-19. What's your response?
Yeah, so there have been several interesting studies that have released and shown the risk with those type of settings. A lot of it's common sense, though. If we know that this is spread by respiratory droplets, especially when you're in close contact with someone, sitting down and eating a meal with somebody outside of your household for an hour with your mask off is a good way to spread that. And I've gotten this question locally some and asking about the data, and we do have contact tracing data, but we're primarily focused on this point is getting information to our positive cases and making sure that they know what to do to protect themselves and others. And people are going to study this. And I think that we will see data that come out, and we already have seen some. But this is not going to be something that's going to be surprising to anyone that works in this every day. I'm looking at all the grain trucks stacked up here outside my window on Breckenridge Street. I'm sure that we could find transportation engineers to do a study on traffic safety and pedestrian safety crossing the street. But if I'm going to walk over to our Davis County Center here in a few minutes, all I really need to know is I need to look both ways to keep from getting run over by one of these grain trucks. So, I think that, a lot of times that we're seeing those type of requests, but I think sometimes we just have to apply some common sense and do what we need to do to get through this.
Okay, and I'm glad you said you needed to look both ways, because even though Breckenridge is one way going north, I see trucks and cars going south on it many times when I try to cross it. So that's a good question. Actually, the governor did say that some studies, and there are all kinds of studies out there, but some say that you're two or three times as likely to pick up a COVID infection from a restaurant or a bar as you are from, say, the supermarket or some other facility. So that's good to know. Contact tracing, here's another one but we've answered it. It says, question about contact tracing. Are restaurants the reason for increased COVID cases? Is data available? I think the answer would be we can't blame it all on restaurants, just as you can't blame it all on bars and everything, but it's a general community spread that right now we are at that point, and you hit the nail on the head, and the governor even mentioned this, that it took us months to double the number of cases that we're seeing, and then it took us weeks to double that, and then it took 2 weeks to double that, and now it's taken just a week to double the number of cases as reported. And when you do that, that is an indication that it's widespread throughout the community.
Yeah, and that's what we've been concerned about all along, and we're seeing it happen, and I hope that it serves as an alarm bell for everyone to sit up and take notice and try to be more careful.
Okay. Are nursing homes required to contact the family of those who live there if the nursing home gets a positive case in the facility? In other words, what is the requirement to notify all the others? I don't know. I'm looking at Claud, but HIPAA may come into effect there. It's kind of like in private businesses. You have an employee that is sick. You don't discuss that illness. Probably from taking precautions to protect everybody else, they will kind of get common sense says, hey, if they're doing this and they weren't doing it, maybe there's something to it. So what is the requirement? Any idea?
Well, I can tell you from working a number of outbreaks with nursing homes, they typically are notifying families that if there's cases in the facility, and certainly are notifying them if their family member has been infected. But they're also required to publicly report that information. Okay. And that report's published daily at kycovid19.ky.gov. Just look for the link for the long-term care facility report. That'll take you to a spreadsheet that has every long-term care facility in the state. You can see the most recent reports of illness and see since the beginning of the outbreak how many cases they've reported, both in employees and in residents.
Okay. While we're talking about this, there's another question quickly. Are you tracing any cases yet back to Thanksgiving gatherings? And my answer, I would think the answer is probably not yet, that there hasn't been enough time for the virus to incubate in somebody that might have picked it up.
No, although we have seen cases that we've worked that reported that they were at a Thanksgiving gathering. So, there are contacts involved from that.
But they had it probably before they went to that Thanksgiving, and the contact tracing would report back to all those people that attended, to quarantine, to watch for symptoms, to go get a test.
Right.
Somebody said that if they taught in another county, would they get their vaccine in that county where they taught, or would they get the vaccine in the county where they lived? And I'm not sure I don't know what the answer to that is. Schools may do like we used to with the polio vaccine. Individual schools, all the kids got a truck, or they'd send a healthcare worker there, just vaccinate everybody that was in the school. So that, I think the answer to that is that's to be determined.
That's right. And it could probably work either way.
Can I see my extended family for Christmas?
I don't know. That's a tough one. I think we'll have to see where we are. I'm thinking that, in our own family, we're going to have to do things differently for Christmas. We all stayed in our own households for Thanksgiving. We're talking about maybe outside on a patio with a fire, maybe just for a brief period of time. But I think that what we need to do right now is focus on what do we do to get through this safely, and with the understanding that 2020 is a little different than every other year.
Well, I would tell you that I have a friend who will remain nameless, but he just got out of the hospital from a COVID infection. And while he says he might have been on the side of some of those who doubted that this thing was serious after his experience, he says it's the worst thing that he's ever been through. As a matter of fact, he had to go back to the hospital for a bit. And he was just pleading with people, believe it, it's real. While the chances are, if you get it, you won't be affected severely or you won't die from it. But at the same time, why in the world would you take the chance? Why wouldn't you do everything that you could to avoid the disease and or spreading it to a loved one? And that's my concern, is that kids bring it home. And we all know what the kids, when there's a stomach bug going through a school, kids bring it home, mom and dad to get it, and anybody else, it runs through the family. And then if they go see grandma and grandpa, they spread it to them. In this case, you spread this to grandma and grandpa, you put them in real danger and real jeopardy. We're approaching 45 minutes. Claude is getting antsy. I know that he's got to get back to court and do other things. And Claude, if you want, I don't know, Clay, unless you have anything that you would like to ask Claude, I don't know that. If you want to stay, you're welcome.
I'll stay if there's something.
Let's just quickly talk about some of the restrictions. Again, let's go back to bars and restaurants. That the governor stopped inside dining, unless then he allowed patio dining or outside dining. And I noticed a lot of tents pop up, but those tents were not, that was as bad, if not worse, than dining inside the restaurant because there's no ventilation there. And I think there was a clarification on that. Tell me the position that the health department takes on dining outside of the restaurant proper in a tent.
So for tents or patios, what we've been advised and what we think is reasonably safe is if you have two sides of the structure open. So that allows for good airflow, ventilation. Now with that, tables still need to be spaced adequately apart from each other. I think as we've alluded to several times during this conversation, eating with someone outside of your household with your mask off involves some risk to it in the environment we're in. Being outside lowers that risk some just because of the ventilation and the airflow. So, I understand the need for businesses to continue to try to operate in some capacity. We think that carry out and delivery is by far the safest, where people eating within others from their household. There's also very much, it does reduce the risk quite a bit for outside dining. So we are asking those that have constructed tents and doing outside dining to have at least two sides open. And then also be cautious of other safety criteria, fire hazards and those type of things. So we're providing that guidance to restaurants when we see that situation arise.
Just a couple other things, and then I'm going to wrap it up. It looks like we've answered. Well, let's see. Thanksgiving. Can I see? Why is there no focus on large retailers with the spread of COVID, where hundreds of people go in and out? Restaurants get all the blame. Most small businesses will close and never reopen. And I understand that. You go ahead and answer it. And if you don't answer it the way I think you ought to, I'm going to answer it.
Okay, well, there are some things that you can do in these larger facilities to still protect yourself and protect others around you. So, for one thing, when we're asking people when they're in a major store or a big store like a grocery store, that they're wearing their mask all of the time. You can't eat with a mask on. We're asking people to stay 6 feet away from other people, and you can't do that when you have people sitting at a table with you. So, we have some need to keep society functioning. People are going to have to get groceries. They're going to have to be able to be able to take care of themselves. So I think what is being done with these restrictions is looking for where we see the greatest risk, and we're seeing what actions would take to reduce the numbers to a level that we don't have the widespread cases that we're seeing now. And I know that it's tough on industries and businesses like restaurants. Nobody said this was fair, but we're just trying to do what we can do to make sure that our community is okay.
Right. Well, I couldn't have answered it any better. So the only thing I would add is, and to this gentleman, nobody's blaming the restaurants for COVID. Nobody's blaming the bars. It's the nature of the business that is causing the necessary restrictions. It's pretty simple. Is there a safe way to have a Christmas party with family and friends? And then the question is, go outside. I think we answered that. I mean, that's probably the best thing to do, is limit it to your immediate household and keep it small. I will make a public comment. There were some people who thought that I had disinvited my son Will from Thanksgiving. I really didn't, and he did come over and he spent time, and while his mother and I ate ham, he ate a big old steak, and he immediately left the home after it was over, quite frankly. And he wears a mask when he comes to visit his mom and I. Because he realizes that he can bring something in to us that would affect us. Couple things real quick. Allocation of vaccines to states are being done on population basis. I think that's about as fair a way as you could do it. The vaccine will be free. The vaccine is free. And we're hoping, the governor's hoping that when this thing gets roaring and rolling after the first year, that we would have up to 1,000 places available where you could get the vaccines. I think he was telling me right now the government has contracted with a couple of nationwide chains, drugstore chains, to distribute the vaccine. So with that, I'm going to close. Clay, as always, thank you. Claude, thank you for being here with us today. I had invited the CDC to bring somebody on, and they didn't. But as always, Clay, you did an excellent job. And thank you for all the work that you're doing. Thank your staff in particular. I know you don't have enough people to do things, and some people have complained to me in the past about, well, it took a contact tracer 6 days before they ever got to me and told me I was exposed. They're doing everything they can. So guys, be safe. Look forward to seeing you the rest of the year. Thanks.
Thank you, Judge.